There have been 2,000 impact evaluations or equivalent studies in development settings since 2006, driving improvements in health, malaria, et cetera, et cetera. Less than 100 in humanitarian settings. So as we construct at IRC our outcomes and evidence framework, all of our programs will be geared towards survival, health, education, income, and also the power of the beneficiary. And our evidence framework, there's huge gaps in the evidence framework, a desperate lack of strategic investment in evidence making that allows us to drive funding into the highest productivity, highest impact.
What do you do to address that?
We do 40% of all the research and high impact evaluations that have been done in the humanitarian sector, but we're not funded for it properly. And so a sector of the global economy that's a $25 billion sector is not investing in the evidence base that allows us, and maybe this is because of my background in politics, we can't say to the taxpayers that all of our programs are currently evidence-based or evidence-generating. That's the commitment that we've made in IRC. Our commitment is that all of our programs will become evidence-based or evidence-generating, because I think that's the only defensible basis on which to be programming. But thirdly, and equally importantly, the third tough question, efficiency is important, but effectiveness is more important. And we say on our website, 93 cents of every dollar goes into programs, and in a way that's a crude measure of efficiency, and that's fine. But where is the discussion about cost effectiveness that links the inputs to real outcomes? And the holy grail of effective public policy is cost effectiveness, not just cost efficiency. And what is opened up by the conversation that Dr. Kim has entered is that those tough questions are going to be addressed by people who know the value of being clear about outcomes, evidence, and cost effectiveness, because around the world, over the last 20 years, there's been I don't know if you'd say a revolution, but there's been a major change in the way poverty has been tackled in stable settings. And we need that same kind of rigor in humanitarian settings. You said it's not just about virtue, it's not just about being big-hearted, it's about being hard-headed. And the reason for being hard-headed is not because we're desiccated calculating machines, it's because we care about the people who we're actually trying to help, and we want to put our money into the things that will really make a difference for them.
Let me give you one example of this. So, we've done study after study after study on the so-called conditional cash transfer programs. And when I got into the bank, I asked, why do we have so many studies on conditional cash transfer? And the honest one said, it's because it was so controversial, right? The idea of actually putting money into the hands of poor people was controversial at the bank. That's not what you do. So study after study after study showed that not only did they have better nutrition, but it actually stimulated the local economy. Children were in school. There were so many good outcomes. The empowerment of women. There's so many good outcomes that now they're in 64 countries. When probably 25 years ago, when I was a protester against the World Bank, that was not something that they did, right? So the evidence has shifted the work. Now, if you look at the humanitarian field, the data I have is that only 6% of all the $25 billion goes directly into the hands of refugees themselves. Now, what does that mean when we know how effective it is to just get cash into the hands of local people? I'm not sure. And so, when you see the kind of research that IRC does, and when you see the accounting that they're doing, we are asked to not only account for outcomes, but we're asked to, as clearly as possible, give evidence of our contribution to a particular outcome, right? So it's a revolution that's happened, and I think it's a really important revolution. The revolution really is a move away from ideology and toward evidence. That movement is happening in many other fields. Everyone's heard of evidence-based medicine now, but this is something that's really only about 30 years old. When I started my training, that was just a relatively new word that we were actually going to be based on evidence as opposed to a few studies and then the way that my mentor does it, right? So can we now move into evidence-based development? We're certainly trying, and other development institutions are also moving in that direction. And so it's not too late. It's time for the humanitarian world to say, we are going to now operate on the basis of evidence.